heavy.
Yep, is that alright?
Good for me.
No, that's fine. I'm over there.
At some stage I'll probably need some clamps. Alright, so we're going to do a goat bilateral abdominal surgery. We're going to make an incision. It's going to be paramedian. Let's see how we go. Let's get that done. That wasn't hard to get into the abdomen, actually.
I was just about to say, it's not going to be a lot of water.
Next to nothing. So your main job, you probably fingers like that, and it's going to be very hard, but just keep on trying to keep that goo in the belly. Ash, have a spatula. Let's switch sides for this one, so I'm going to go for the testicle closest to my side. So those two fingers, and push away. And I'll have a little look-see.
I think Ash's situation was sorted.
Okay, so I can see our testicle, which is tight, so it's got to kind of figure out what's what. That's going to be the vas deferens. There. That's going to be probably the gubernaculum. That was failed to pull it through the inguinal ring. There's no massive blood supply there. That means this way, which is ultimately really taut, it's probably our testicular artery. Just there. My computer. Yes, it's been fine. I think I can get an RxWorks now on it. Yeah. So, just going to see what I can transect, that I can actually exteriorize this testicle. I'm just going to hold that out of the abdomen for 1 second. So just grab the whole testicle. I'm going to come over to your side now. I'll grab our testicle. Good. Yep. Yep. Tight fibrous band here, which I don't want to rip. stitch these. Need to ligate that. Let's keep all that back. Just to gently hold that and make sure that I'm not gonna, yeah. Mess that. So I think for now I just need to see what I can do. I'll just hold there for one moment. It is exceptionally tight. I'm concerned that it could very easily rip. There's also a hair there which I want to get. Okay. There's a tight fibrous band here which I think I actually need to transect, or else I'm not going to be able to exteriorize it at all. I wonder how this will go if I just transect that, let that one go back in. That gives us a bit of mobilization. I'll have to maybe do a ligature. It's tight. I think that's what we're going to be working with, to be honest. So that one can dive in there. Can I please have some suture material, Steph? Have some zero filler one.
Hot?
Yeah, so the issue we have, and I don't know if this is just me, but there's some tight bands. So I believe this is going to be the vas deferens, which I will ligate. I don't know what that was, but probably not good.
If you were wrestling, if you didn't have another set of hands, then you...
Oh, I couldn't do it. Couldn't do it. My goal was to hopefully use one incision, but based on the tightness there, I'm not sure. Like I nearly ripped through that vessel. That's a real risk of the procedure. Just a bit cock-handed. How will I do this? I'll go through the hole. Around that side, I guess. Touch that one. Anesthesia's been pretty textbook.
Flawless. I don't think I worry mildly about this temperature after the last relaxation we had, but it's a post-operation. I think it'd be so unlucky that happened again. And I think analgesic pregnant reduces the risk.
Nice.
I had a little bit of hypothermia.
have a word with Ash. Alright, so that should be the vas deferens gone. Now we're going to see the much more important artery. Have a look at that, see if it's bleeding. It's not bleeding. Looks like a good vessel, a good ligature. Okay, let's have a look. Let's get you to hold that one back there. You want to find out what it's about, Ash. There is some subcut tissue here which I can possibly get rid of so I can ligate that artery a bit. Like that all, to me, looks like subcut. I think I should try to ligate the artery. I'm going to be pretty chicken today, so I'm going to do it. Even though it looks like subcut, let's ligate it. I've never done it before. I just don't think we take the chance. I'm going to open up that clamp a bit to crush it down as much as I can, because we're not exactly doing a very good ligature. Anything can forward in Ash? No. Cool. That always puts shivers up my spine, but okay. No, nothing. Alright, so I've got a ligation after that, which I should now be able to at least transect to there without it bleeding. Making sure that's my artery there. And we only have the artery left, which should be, yeah, that's going to be easy. This may bleed for a bit as I remove these clamps, but I'm going to quickly clamp the artery directly. Cool. I'm going to swap the sides. Yeah, that's no ideal. Right, can we that's alright. Just going to do a ligature underneath that. Say again? Still. No. Still on the first one. I'm just about to ligate around the artery. I've been been pretty cautious, I guess. With that hand, you don't mind just grabbing that testicle and you just, yeah, just very gently, that's perfect. Scooch that one. I'll do one ligature, nice and underneath that clamp, so it's not gonna impede a good ligature. This one will go good, Steph, it's just see what the next one does.
At least this side is where we thought it was going to be.
I think it shows that, you know, at least we can pick them up on ultrasound. It's nice. What we thought it was. Alright. It's one side done. We will.
It'd be so good if you get out or something.
I honestly don't think I even try.
Okay.
I can try, but considering that I nearly ripped off the artery there, I think that would be dangerous. So, we'll drop all this. There's a little bit of oozing, but I don't think there's any reason for... If we have a look at our main artery, that's pretty good. This was just a tight band of tissue. Looks pretty good. Not sure what this was. That was probably the tight band of tissue. Which I just clamped. So that's how tight the band of tissue is, how far in it's gone. That's just a tight band of tissue that should not bleed by any means. Make sure this swab doesn't go, make sure it comes back out completely. Cool, so I'm very happy with that. I think it would be, we'll swap sides. I could try to get the other testicle, but I don't think it's a smart decision. I think we go exactly where it is and then we switch them both.
I think you should close it off first.
Do you want to grab me some 2.0 PDS? Grey. I'll swap your sides again, sorry about that. There's a lot of dancing in this surgery. You can see if we can see the other one, but it's essentially you have to go all the way underneath the bladder. It's just there. Maybe we should see. Say again? Got him. Maybe I'll see, Steph. Let's see if we can work in it. So, what you're going to do, 2 fingers here, and now we're kind of pushing down. So 1 finger there, the other 2 fingers. Just see how you go, kind of pushing down to that region, and maybe we'll do it all there. See if the bladder gives us grief. That's good, let's see what's what. You could. I'll just see, so I can definitely, that's going to be our vas deferens again, so let's maybe just start removing things that are impeding. So we'll start, no vessel there. It's also that tight good inoculum. We'll just start by ligating some stuff. Let's get rid of the vas deferens. Could be paramedian for the win.
I told you. Always right. I'm the queen of the small room.
underneath our clamp awkwardly. Pretty happy with that. Similar deal, I'm close to my clamps, I'm going to open it up. Tighten it down. I'll re-clamp it. Have a look at that. So it's not stuck in anything all the way through. Good. That's the vas deferens, so I should be able to transect it straight away. It shouldn't give us any grief. Good. A small blood vessel in there, but happy with that. See where else some tension is. Everywhere. This one's actually better. This one's a little bit more flippy floppy. Same as before, so I think our vessel's there. Break down this subcut fat. That looks all pretty avascular. Small little vessel there, shouldn't matter. Get it so we can mostly see the vessel, which I think we've done, and I think we do one more ligature. Right there underneath everything. Same deal, so we're going to go for one perfect ligature. I would struggle to do more than that, to be honest. So we thumb to thumb, hold for a good bit. When in doubt that you're close to the hemostat, you open it up. Because we don't want the hemostat in any way to be keeping our ligature from tightening down. Follow it up. Same treatment. Transect, making sure we're happy we're getting every bit of testicle. I'll be honest, it's close. It'll be. There's obviously the testicle there. Have a look with me, Steph. I'm happy with that. I'm close, but there's the testicle, and that's obviously just going through the. Maybe that. Definitely not going to be reproducing. Have a look. We can just let go and have. Not bleeding. Awesome. Work, everyone. Just got to suture up now. 20 minutes max, probably. Okay, so yep.
I'd say to hit the dehorner.
I'll heat the dehorner. I would say 20 minutes. We'll see how quick we can go.
Once that's done, can you please put the hair around its head? We've only got one. One side.
Alright, so you can let go of everything there. Great work. Now let's see how we go stitching. I think paramedian worked well, but it's very tight. I could have gone more midline, just underneath the penis. I guess that would work. Happy I didn't go in front of the penis. I get you once again just to kind of hold them a bit back as I start off. I'm going to do our bites very close together. I'll repair that little deficit, I think. What if we shut that one again, Ash? I'll get you to pop out of there for a moment, just want to see what it looks like. Cool. Would you mind maybe grab, is there an Alice tissue forceps in there or something odd? Alright. Yeah, beautiful. Just going to hold that just a little bit up. The other hand, you're going to grab a hemostat. And all you're going to do is poke it in that hole and just push that fat down. Yeah. Alright, I'll get you to come out. I'll let go there. Little tear here. I'm hoping that the fibrous outer layer is the strength holding layer again. Could be bloody wrong. Hopefully I'm not. There really isn't much to the abdominal wall. Ash, can we have another? Maybe 2O. Maybe 2O Philipron.
2 o'clock.
Yeah. Yeah, there you go. Doing that last row blindly, so I've got to make sure I'm very superficial because there really isn't anything between the outside and the inside. Cool. Give you that one. Every 2 to 3 I'll try to pull on through and see how this comes together. I might tack down a little bit. And pull through. Yep, come there. Perfect. Cool, come on through. I'm going through it with my suture. Hopefully as I tighten it, it will stop the bleeding. Let's see. Let's get to hold that one. Yep. Beautiful. All right. Last up, we'll do some externals. I should quickly have some 2O nylon. Thank you very much. It's awesome. Could do forward interlocking, but hopefully just do push it and call it a day. cooking in here today. Have you got the heater on?
Yeah.
Have you got the heater on?
Yeah.
Good for the goat, too much.
It's turkey.
It's the heat coming from the window.
Well, it's like, probably 33 degrees outside. I think it's meant to get to that hot.
Nearly there, Steph.
Happy?
I'm pretty happy with that. I could have gone underneath the pins, I reckon, and maybe would have made both a bit easy, but at the end of the day, that was pretty straightforward. It's just this side that was weirdly tight. But no. Doable.
Good job.
Good job. Bit of a dog tag here. The doggy. Well. Right on the teeth.
You're gonna have an issue with putting its head in here.
Can we avoid it?
Yeah. Yeah, we're gonna put it out into that one and make it extra.
Hold it. Good work, guys. Recording's done. Can we avoid it or?